LASIK is a wonderful procedure because it corrects all kinds of prescriptions, whether you're nearsighted, called myopia, you're farsighted, called hyperopia, or even have astigmatism, which is the shape of your eyes instead of a soccer ball. It's like an American football. They can all be corrected with the LASIK procedure. Of course, we have to know that you're a good candidate, and that involves additional testing and knowing all about your eyes through very specific, specialized diagnostics. But ultimately, most people are a great candidate for the LASIK procedure. Let's understand the differences in the actual procedure of LASIK versus SMILE. LASIK, the idea is you create a flap door, like a hinge, lift that flap door, and then another laser corrects the shape of the cornea and reshapes it in order to correct one's prescription, and then that flap door is replaced into position. In SMILE, the difference is that it's minimally invasive. There is no flap. There's a very small pocket incision, if you will. And the idea is that the laser is able to create a disc-shaped tissue called the lenticule within the body of the cornea, and then accessible through that small pocket incision. And when you remove that lenticule, the top and the bottom layers of the cornea come together nicely. And again, your prescription is corrected that way. And so slightly different ways to do them, but both work very well and both are very safe and effective. The recovery period of LASIK and SMILE is actually very comparable. Shortly after surgery, the little flap edge of LASIK or the little pocket incision of SMILE begin to heal. The recovery process, even within the first few hours, is really painless and comfortable. The next day, you're beginning to see a lot better. Of course, there may still be a little bit of a foggy vision, but it gets crisper literally hour by hour. But within the first day in SMILE, you can go back to your normal activities. With LASIK, I'd want to make sure you're a little bit more careful so that you're not accidentally touching the eyes or anything's coming close to the eyes. Because again, that flap is healing and is a little bit fragile in the first early postoperative period. But otherwise, you really are able to go back to your regular day-to-day activities in both procedures with a little bit more comfort and reassurance with SMILE that you're not worried about what if something comes at you. So if you've had laser refractive surgery and you're wondering, can you have cataract surgery after? Of course, everybody gets cataracts. And as long as you let your doctor know that you've had a laser refractive surgery in the past, they may sort of dictate some of the lens options or the way some of the calculations are done, but you can still totally do it. In no way does it affect the ability to do cataract surgery safely and effectively.